Okay, so endometriosis is a condition in which the uterus lining, which is called the endometrium, is located in locations outside of the uterus.
And what the impact of that is?
The impact of having endometriosis is that it can cause chronic pelvic pain and infertility.
And what do we do about it?
Well, the interesting thing about endometriosis is that while it is one of the most treatable conditions, it's actually one of the least treated. Many women will go to maybe 6 or 7 doctors before it's even diagnosed.
Is it hard to spot, or what is it?
Well, it is diagnosed usually via a laparoscopic surgical procedure. And so many women who come in with chronic pelvic pain, if they go for something that's called a pelvic ultrasound, which is just sound waves, it's not radiation, may or may not pick up endometriosis. If it's involved in the ovary where it's called an endometrioma, then it may be detectable by the ultrasound. Other than that, you may find a very unremarkable pelvic ultrasound. It may say a normal pelvic ultrasound, but the woman will be continually complaining of pain. And the way to diagnose that is through that laparoscopic procedure where you're actually getting tissue biopsy and a tissue diagnosis of the endometriosis.
Good. And so this is something, is this kind of thing you have patients come to you for? It's painful, right?
It is quite painful, absolutely. And yes, I see many women in their mid-20s, 30s, and 40s with chronic pelvic pain. And for many, it's a very debilitating type of experience. And I think as we begin to engage and have more awareness of this, it has to start from the patient's understanding that this may be a possible cause for their symptoms, but also to educate primary care doctors and to let them know that maybe you need to consider this as one of the diagnoses.
And is it growing? Is it a condition that's it's just kind of generally always been out there, or is there more of it around? Or
I think it's I don't know if it's necessarily growing or is that maybe as the awareness grows, we are picking up more and more cases of this.
good. And is treatment fairly simple, or is it how involved is the treatment?
Well, I think we have had advances now, and so that there are more advanced laparoscopic procedures that are done in that instead of just cauterizing or burning the lesions when we go in surgically, there is usually a wide local excision that's done around the lesion. So instead of just taking off the tip of the iceberg, the actual implant, that endometriotic implant lesion is completely removed.